Hello guys, welcome back to my YouTube channel. Guys, please subscribe and comment on the video before I continue. Alright, so it's case number 3 and the scenario is you are on a on-call foundation year 2 doctor when a 70-year-old woman is admitted with sudden dyspnea. She denies any pain, she is apyrexial, she is a heavy smoker. So one hint is that we have a heavy smoker. We first of all, as I mentioned in the previous video, look on the age, that 70-year-old woman. All right, genders, in some scenarios gender also describes most of the diseases, but here it's not that much fruitful. So it's a 70-year-old woman, age is important, admitted with sudden dyspnea. This means that it's emergency condition and she's facing difficulty in breathing. She denies any pain, no chest pain. That's a very important history, because in case of dyspnea you should look for heart attacks or anything. So there is no chest pain, so it rules out everything. And she's apyrexial, no fever. All right, so no infection. Thought process, she's a heavy smoker, which is a very big hint. Now let's come to the questions. First of all, just rule out all the causes that with sudden dyspnea. It means that sudden dyspnea might be trauma to the chest, but no history of trauma given. All right, then sudden thing in this way, from outer border to inner lining of the lungs, because chest is excluded. She denies any chest pain. It can be, but first of all, respiratory system is involved in this, so rule out this. All right, and then comes the heart as well, because in this we can from heart we can also have dyspnea. So what name 6 features on the patient's history that would inquire about to narrow down the causes of her breathlessness. All right, so this is the hack. In any symptoms given, you are supposed to follow this OD para. All right, so it's onset means from how long have you been having this symptom. Duration, onset is sudden or gradual, and duration is how long have you been having this symptom. The intensity of this breathlessness, then progress, is it improving, or are you taking anything, or you have narrowed down all the causes. In this way, most at the end of the questions you will be clear that which system is involved, either it's heart, either in lungs, either these are kidneys or whatever. All right, then any aggravating factor, that means that any activity that relieves the symptoms or alleviates the symptoms. Then relevant, is there any associated symptoms or anything. Then associated symptoms that are relieving factors, like this. All right, so let's read the next point. You examine her cardiovascular system thoroughly and discover that she has an ejection systolic murmur. Oh my god, this is the biggest hint. All right, so now we focus on the heart system. As on examination we found out that she has ejection systolic murmur, you decide this may be secondary to aortic stenosis. So this is here the clue, all the big clues. Now we are having ejection systolic murmur. I would like to a little bit explain to ejection systolic murmur. Now consider your heart. When the heart is pumping, it's ejecting blood, right? So ejection first of all. During contraction, when heart is delivering blood to the systemic circulation, it's ejection through the aorta, right? So ejection. And as you know, during contraction the phase is called as systolic, so it's systolic. Ejection systolic murmur, so it's aortic stenosis. Why not aortic regurgitation? Because in aortic regurgitation, when valves are closed, they prolapse. Like, it means in aortic stenosis valves are narrowed like this, they are opened. All right, they are opened, and after opening they are narrowed and blood face difficulty reaching the systemic circulation, so it's stenosed. This is the term stenosed. But in aortic regurgitation the valves are closed like this and they prolapse like this in the backward direction. So blood starting flow in this direction, it comes backwards. All right, so this is aortic regurgitation. But in this case, ejection systolic, you have to open the valve and contraction, and as there is ejection because the blood is pumping in the systemic circulation, so this is aortic stenosis. All right, in this way you figure out that which might be the cause of this ejection systolic murmur. Alright, so come to the next question. List 4 other examinations that would be keeping in aortic stenosis. Now you have a patient, you have your patient and you are examining him. You are given the already given that he has aortic stenosis. So what would be the examination parts that you are supposed to take? So first of all, as in aortic stenosis, I have told you that the valve is narrowed, alright, due to some other factor. It can be congenital valve anomaly, it can be age related degenerative condition, or it can be rheumatic heart disease. All right, you have heard, you have already familiar with these terms. If not, comment me in the section, I will explain. So these are due to any factor there is aortic stenosis, so blood is not completely going into the systemic circulation, right? So less blood and less blood volume, so pulse will be feeble and will not be that strong. All right, that is of good volume. The next is apex beat. Apex beat is the strongest beat that you hear at the left side of the body. So it's heaving. What's heaving? It's like because of blood can't reach into the systemic circulation, it comes back. Where it comes back, it will enter into the left atrium, from left atrium into the left ventricle. So the left ventricle will receive all the blood, and it will contract more powerfully to push the blood that I told you in the previous video, that is Frank-Starling mechanism, to overcome the deficiency. So what happen will be, there will be concentric hypertrophy of the left ventricle. This will lead to heaving apex beat. All right, apex beat is felt in the strongest part, that is left ventricle chamber. All right, so this is apex beat, and it will be of heaving nature. Heaving means that something is built up, and whenever you feel the pulse, like with your finger, you will feel a heaving, yani uphill direction. All right, due to this concentric hypertrophy of left ventricle. And murmur as ejection, I have explained it earlier that it will be ejection systolic murmur. You will put stethoscope on the heart sounds to hear the heart sounds, and you will hear ejection systolic murmur. Alright, the next step is what would be the due to back return, what other examination we will have. Due to back return, we can face heart failure, as the blood will backflow, so it will keep moving back to the body. It will not go into the systemic circulation. It will pull up in the back way. So this will lead to heart failure symptoms as well. Alright, I hope this is clear. Please like, subscribe, share this video. Alright.